Hi, do you mind telling us who you are?
My name is Faysal El Kak. I live and work in Lebanon, specifically at the American University of Beirut, and also at the AUB Medical Center. I would love to see myself and to be seen as a women's health activist and women's rights activist.
I think that is how we see you, to be honest. So,
Thank you very much.
what I would like to ask you is if we could start, if you could say something about how COVID, with all else that you're dealing with in the current moment, kind of how, and that Beirut is dealing with in the current moment, how is COVID impacting what's happening around you?
Well, it is impacting us big time and in many different and unknown ways. We were one of the first countries to be alarmed and make universal, global, national awareness and even lockdown. And we were doing like 10 cases, 15 cases a day in a country of 4 million people with additional 2 million refugees. And then there was kind of laxity towards May and probably June. There was so many political issues, demonstrations, and then came the Beirut port explosion, and it went really like uncontrolled. Uncontrolled. We're talking about 1,200 cases a day. We're talking one of the highest numbers in the world in 100,000 population. We're talking 260 to 280 cases. It's affecting access to services. It's affecting the people in their economy and their shops. It's affecting restaurants, hotels, the whole tourism sector. And already the country is suffering from a lot of economic crises, devaluation of the Lebanese currency. Specifically in my practice, people are choosing to postpone their surgeries, to postpone essential screening tests for cancer in women and otherwise. It's affecting even antenatal care. It's affecting our teaching to medical students. It's really affecting us in every aspect. This is very dramatic.
I hear you, and I also think about so much of your work is local, and then you also work so much globally. Are there issues that you see for sexual and reproductive health and rights that are things we need to be thinking about affecting you in Lebanon, but also at a global level that we should be talking about?
Yeah. SRHR is really falling behind. People are being very busy with the maternal health care, and that's important. But issues, for example, like abortion, post-abortion care, emergency contraception, family planning, detecting violence, reducing violence against women, sexual violence, all these are affected in a negative way, and they're falling behind. And when women are locked down, they're not able to really pursue their sexual and reproductive health. Like, for example, in Lebanon, in one of the NGOs that caters for supporting survivors of violence, of sexual assaults, there is a 60% increase in the number of people calling for help, either because of harassment or sexual assault, and 60%. In many other countries, reports from the US, reports from India, other places also talking about between 20 to 30% increase in the number of cases reporting that we have been subjected to some kind of gender-based violence.
And I think, and we always say that the number of people who call is so much lower than the number of people who experience.
Exactly.
Right? So
very true.
One of the things that has been really striking, I think, to many of us is that in many countries, COVID has resulted in a lot of policies being put in place. Some of them that are more harmful than not, some of them that use police power, that use criminal law, that are all in an effort to try to curb this public health crisis, but in many ways that are abusive of human rights. And I wondered, are you aware of, are there policies that you consider to be very much of concern that you're seeing?
The responsiveness of the government and the readiness of the government to deal with the recent surge of COVID-19 cases is not there. What also is worrying is that most of the funds, whether coming from the World Bank or from the other funders, are shifted towards strictly dealing with, of course, advanced cases of COVID, which is very legitimate and very serious and everything, without looking at the other aspects of health and of people that can be affected by COVID. Another example, when they tried to make the like rescue packages for people, especially those who are below the poverty line.
So can I ask, what is in those packages?
Basically, these are food items and like basic medicines for like headaches and things you use every day and food. But there is nothing that looks at women's daily needs. They did not include the sanitary pads. They had no idea about menstrual poverty and period poverty. Did not include other intimate items that women might be using in the lockdown and they cannot afford to buy. That's also very important. And women's groups and NGOs were not consulted to what really should be included in here.
And yet it's very heartening to hear of the government actually putting together these packages, even if things have been forgotten. There's so many places where that's not happening, you know.
Exactly.
My last real question to you is, you know, when we think about everything that has occurred, really, I mean, it's only been some months now. It feels like it's been years, but it's only been some months. You know, what do you think are some of the most important things that we as a society collectively should really take out of this experience? What do you think are some key lessons that so far that we've learned that really we'd like we should be paying attention?
It's a lesson about equity, discrimination, and about bioidentities and bioethics in the existing healthcare systems.
Thank you. I mean, you've given us a lot to think about and a lot to talk about. Thank you for that.
Thank you very much for having me.
Right.
And good to see you. Thank you very much.
Thank you. Take care.